Good afternoon, everybody. I would propose we start the meeting. We miss all a colleague in C4, Attila, but he will join maybe later because he's at home, because here we have a kind of snow emergency, so there are many colleagues, let's say, who cannot travel at work. Now the weather is getting anyway better, so I would like to start, first of all, to thank everybody for the nice work we have done during 2018. I think that we succeed to have, let's say, to shape three joint statements, which are all the three joint statements are very prominent, are very relevant. They are also policy relevant. It was, of course, a lot of work and a lot of mediation, and I would like to thank also the coordinators for the three joint statements, for their commitment. And indeed, I think this helped also to shape a little bit, let's say, the profile of the health policy platform in general. For us, I think a thematic network is very important because, first of all, it's increasing the user in the platform, it's bringing new energy, new people. So we would like very much, let's say, to have this kind of dialogue with all the stakeholders. And we hope very much that you would decide to keep the thematic network, to transform this in a stakeholder network. This will help us, let's say, in making the platform a bit big, a bit more prominent. And it is for sure for everybody a win-win situation, because for us, I think we are a kind of service provider in this business. I think to have a platform which is prominent is important, because we can have much more influence with policy unit or with different DGs. And for you, it's also a kind of win-win, because you will have more people, let's say, on board, and you will find the right connection and the right synergy. So thank you, everybody. I would like to thank also the colleagues following the joint statement, which are now online as well. Today meeting is quite simple. We will have a first part of the meeting, which will be dedicated to the three joint statements. We go one by one. Of course, I don't think that there is a need to have a big discussion on technical issue here. It's more or less a lesson learned, and it's in particular to understand how do you want to take forward the joint statement, and also, let's say, if you have any advice to improve the system, let's say, for the future. This will be also the argument of the last point, let's say, because if time will permit, I would like to open, let's say, 10 minutes brainstorming. I would like to listen about your experience in the platform, which will not be linked only to the shaping of the joint statement, but in general. For instance, what do you think about the meeting? What can we improve? What about the newsletter you received, the big weekly newsletter? Is this something for the spam, or is it useful? How can we revitalize, let's say, the Agora, so that it's becoming more interesting? So all this kind of feedback, I think, is very much welcome. And if it is not done during the three vertical presentation, I will try to get 10 minutes at the end to talk about that. So thank you very much. I propose to start. I think we can change here the slides. How do I do this? Like this? No.
Oh yeah, that's true. I do it.
Okay. We can start, and I began to prepare a new slide for me to tell you about the accomplishment of this year. And what we can say is, in addition to what I already said, that let's say the interest is very much increasing. We have prepared some statistics since 2016, and we see that, for instance, only for the endorsement, an average of 20-30 endorsement in 16 is now arriving to basically an average 70, even more. So this means that there are always more stakeholders, let's say, which are very much interested into the matter, and this is an encouraging figures for us. It's of course also encouraging for you who have produced the joint statement. Also, the webinar have increased. We have today, this year, 6 webinars, let's say, on 2 per joint statement. And at least in the webinar I was chairing, I was offering also to the leader the possibility to have additional webinar. So this is a possibility which is always open. And of course, I mean, also the meeting was helping in having visibility. The meeting was followed by 130 participants, more or less. But the meeting was web streamed and was recorded. And we have seen, for instance, that in the 3-4 days after the meeting, let's say that the number of views of the recorded video was about 3,200 views. So there are numbers which are quite encouraging. This is, let's say, meaning that the stakeholder community is increasing. But let me also say that in the platform, there is not only, let's say, stakeholder community in the meaning of NGOs, but we have also a lot of member states. Let's say we have many joint action, and we are starting, let's say, increasingly to have also an interest in research, let's say, institute and university. And I hope this angle will be, let's say, for next year a bit more focused, so that we can have also networks, let's say, including people who are doing the job, who are doing research, let's say, on public health on the issue which are relevant for us. So thank you again, and I propose to start. I think the first joint statement is the smart health edge-friendly environment. So I give the floor to Karina Willeke. I don't know, would you like to start? And then we will see if there is any question or any discussion after the presentation. Thank you.
Okay, so please let me just know that Willeke today is on another conference, also presenting SHAFE. So Javier Ganzarain is representing Academy and will share the presentation with me, okay? I'm sorry, could you hear me?
Yes.
Yes, we can.
Oh, okay, thank you. Can I share my screen or?
Yes.
Okay.
Let me give you presenter rights. Now you should be able to share your screen.
Okay, let me just go back. Okay, can you see it? Can I start?
Yes.
Okay, thank you. Okay, so most of us already know each other. I'm Karina Dantas. I'm from Caritas Coimbra. Along with Academy, we were the promoters of the Thematic Network on Smart, Healthy, Age-Friendly Environments. That has a very long name, and therefore we already call it SHAFE for the whole year. So the main objective of SHAFE was to connect all different European stakeholders on a common vision on smart, healthy, age-friendly environments, and try to issue some recommendations either to the Member States as to the Commission on how they can be effectively implemented. So we got to a joint statement with 5 main areas, which was the shared vision, the cooperation between all the stakeholders, the funding that would act on top of that, and the contribution of research focused on prediction and prevention, and also of citizen empowerment, that would help bring this policy recommendations to action and not just leaving them as a policy statement. So for this work, we had, now correcting, I think, the numbers that Julie presented in the beginning, we reached 142 partners and endorsers. So I think it was a nice result. A lot of these partners and endorsers actually accompanied us since the beginning of the SHAFE network. So I think this represents a little bit of our first lesson learned, which was that the whole thematic network and the possibility of us applying for it and being supported by the health policy platform and by DG Santé and DG Connect was actually very important to bring us into the center of the discussion of health policy, either because we gathered a big group of stakeholders and that was recognized for authorities, but also on the other hand, because it allowed us to discuss a lot of things with the Commission and with Member States on a different position. So I believe this was a work that we were already doing somehow, but the fact of being a thematic network helped us to bring it to a different level. So on that sense, it is for sure a very positive outcome of the cycle. So as we said, we had a lot of interest in many stakeholders, and in fact, one thing we have to say is that a lot of them contributed. So that is not that often in a lot of networks and groups. Many times people are very interested, but then it is difficult for engaging all the stakeholders in actual work. And for example, the framing paper that we delivered had more than 70 pages, and a lot of our stakeholders sent a lot of contributions to all of them. They read it all. They sent their comments. They included new sections, and for sure that is a very positive outcome as well, because this made us all have the same language and knowledge. Of course, as a summary of all this, this was only possible because the cooperation with the European Commission, and that also with the other thematic networks, was very positive. So there was constant support, a very good welcome to a lot of ideas, and we felt that was very important also for the results we had. As suggestions, we just would say that for us it was an issue that the thematic network was launched a bit late, because that left us very small time to do all the work. So it was a very busy summer to be able to deliver the webinars and the framing paper and etc. So maybe this could be a suggestion for future calendars for the networks. Also for us, because we have a core team of 4 people, and I think that some other networks do as well. And this is in fact a volunteer work. It would be good to have some more support on travel costs for the kickoff and also for the annual event. That would not be only for 1 or 2 people, but for a working group, because I think that could have brought more people to the events and to the discussion. So it is still a very small amount, I think, for the work then, and maybe you could support it. So now I would pass to Javier Casarin for the next steps, because it is only 1 slide. If you agree, Javier, I can leave my presentation on, and you can connect yourself.
Yes, please. Thank you very much. Can you hear me now?
Yes.
Okay, perfect. So thank you very much. I hope you are not disappointed that our beautiful Villeke is not participating today, as Karina also said she's in another event, but she certainly sends you all her greetings. So thank you very much for giving me this opportunity. I would like to present you what we are going to do next for the next year. Well, first of all, we have 2 very big objectives. And the last one will be to present the white paper, but for this we need a stakeholders network. So from the current thematic network, we will evolve very soon into a stakeholders network. And as Karina Dantas already mentioned, we already have more than 140, concretely 142 today, endorsees for this job. For the joint statement, actually, which has already been presented in November to the European Commission. So once we gather this stakeholders network, what we also want to do is to check first if all the kind of relevant stakeholders are very well represented. So we will make a certain analysis, and in case needed, we would like to invite and include in this stakeholders network also these kind of stakeholders that are missing, perhaps national and regional authorities, insurances, for instance, and also health and social care service providers, but also those stakeholders that implement and scale up these kind of solutions. So this will be done at the beginning of this year. You can see in the yellow or orange bubble. Then from there on, as you can see, we want to do that in a very collaborative work and way. So we will do different kind of sessions, brainstorming sessions, also discussions, webinars, etc., as we did in the past, because certainly the collaboration of each and every one of these stakeholders and partners is very relevant. So we will collect the different overviews and inputs from these partners, until beginning of summer 2019. So we don't have certainly very much time, but we, with the support of everyone, will be very efficient. And depending on the topics that we all identify, we will define different kinds of areas, and for each of them, we will define in an effective way working groups. And of course, you can understand that all this needs to be coordinated so that we are still efficient, and we manage. Then our next objective is to recommend, no, sorry, to collect and disseminate the recommendations of the solutions that have been gathered by end of fall 2019. And then at the very end, we will also join all these results into one single document, which will be a white paper, which shall be presented during spring 2020. And you have here in this slide a brief overview of what is our next upcoming plan. And I would already like to thank the European Commission for the support, and also certainly all the partners for all the upcoming work. Thank you very much in advance.
Thank you very much. I don't know if Horst or Roger, they are online, they would like to add something. Of course, I mean, you are also invited to give us your feedback, also in terms of organization. Marta, if you believe that you have something to say. Horst?
We keep being muted and unmuted. Sorry. Yes, I would like to say a few words. I also have some slides. I don't know if I can share my screen as well, perhaps.
Yes. I will give you a presenter rights, just a second.
Nice. And just for the record and the minutes, Roger is not here because he has left the commission.
Okay.
And it's Isabel Deve in DG Sante who's there. But just to be sure.
You can share now your slides.
Okay. Can you see it?
Yes.
Good. Okay. On the content of the statement, I don't want to go into too much detail because I think I gave most of the feedback at the annual conference. There are just a few things that I would like to point out, which I thought were noteworthy here in this particular context. What I and we particularly liked about the joint statement is that many of the aspects that it mentions are very much in line with a lot of the ideas that the Commission already has, and that we also discussed with member states. But it gives it sort of new, more concise perspective on this, and particularly the appreciation of the actual real-life implementation rather than sort of theoretical frameworks or discussions. Then the question of the quadruple helix approach, which is also something that we try to foster and achieve with the cooperation with the stakeholders. And as also Karina was pointing out, the point of the bringing this into the discussion around sort of innovation in health and care, and making that sort of part of the general sort of mainstream policy discussion. I think that's something that's very good, and that also helps us in sort of shaping the policies. And this is an actual added value of the thematic network, which I think is already also a lesson learned. I just realized that I may be sharing the wrong screen, but anyway, you get the idea, I guess. And I really also wanted to reiterate that I think it was the thematic network took a very constructive approach. I know we had the discussions in the beginning about the question whether it's this kind of listing, having a long wish list, or just only requests and requirements towards the Commission. There's certainly an element of that there, but I think it was in the discussions and also in the results that we have, it's a very constructive approach, because it also makes the distinguishes between the different contributions that different types of stakeholders can make, and the Commission is one of them. I mentioned it in November, and I think it's worth mentioning again that this sort of cross-domain approach that is taken in this statement is also very much appreciated, and that I think that in the future work, especially also on the white paper, you should also look into the fields of mobility and the infrastructure that enables innovation and digital innovation for smart health, age-friendly environments. I think that's an important aspect that should not be forgotten. I mentioned also, and I don't think we have seen it that much. It's sort of a concise definition of smart, healthy, age-friendly environments, which would help in sort of also attracting perhaps new stakeholders that identify themselves with the fields, and some sort of examples of existing environments of that kind. So that's on the content. I think these last two things I think could be added when you prepare the white paper and the future work. If we look into the lessons learned, these are, I put the two arrows because I think these are two aspects of the same notion, which is we have the impression that the thematic network as such is really of added value itself. At the same time, this brings with it some new challenges. We have to make sure that the thematic network is clear in its presentation to the outside world, is clear where it's positioned with regard to other stakeholder groups, with regard to expert groups, with regard to the policies that the Commission puts forward. In this case, specifically the communication from last year on digital transformation of health and care. So it really, as I said, brought some added value. You have all these supporters, all these endorsers, but it is a new challenge in then sort of communicating how this is related to existing stakeholder networks, the European Innovation Partnership on Active and Healthy Aging, the Covenant on Demographic Change. This is something that I think may be also the case for other thematic networks. Where do we position them in this kind of environment, ecosystem of stakeholder networks? But it really, and that's also what I wanted to point out, it really shows that there is a lot of potential for mobilization of different types of stakeholders, also in addition to what Javier was just saying, that there's really a willingness to bring everybody on board who is active in this field or who might become active in this field. So that's really good. Another lesson learned from me is that we have to think about sort of sustainability of these thematic networks beyond the annual cycle, and we've seen that there's a lot of ambition and planning in this particular thematic network, and it is something that I would assume is not necessarily a given for every thematic network, and that's something I think we need to consider as the Commission as well. How do we take that forward beyond just the platform, if I may put it that way? In terms of next steps and cooperation, for us, this has already been quite instructive, and I think I said in November as well that especially the framing paper was of great value to us also in terms of getting information on what is out there, what the ideas are, what the needs are of the stakeholders. So that informs policy. It informs also planning for research and innovation programs. I think what we have to make sure is that when this is taken forward, that it is also well coordinated with the Steering Group on Health Promotion, Disease Prevention, Management of Non-Communicable Diseases, and with some of the initiatives that are funded by the Commission, specifically also through Horizon 2020, the Digital Health Europe coordination and support action, and the Homes for Life project specifically, both of which were just recently kicked off. And I think they are main interlocutors for the group that runs Schaffe. So that's something I think that should be taken into account. And for us also, we will take all the input that we get from Schaffe and that we already have from Schaffe into account for the planning for the Digital Europe program, for the Connecting Europe facility, and for Horizon Europe, especially with regard to the new partnerships that are being prepared and that are currently being discussed as well, where I think this kind of network or stakeholder group can give us good ideas of what would be worthwhile to fund under these programs, and all this in the under the umbrella of the idea to support the idea of stronger focus on prevention, home-based care, and citizen empowerment, all of which are policies that the Commission has put forward. So this is, for me, is the main point. I think we will have probably a bit more discussion about process and procedure when we do the brainstorm. Thank you.
Thank you very much, Horst. Before to have a final word, I don't know if Isabel would you like to add something or to say something, Isabel? No? Okay, no problem. Well, I think it was really interesting because we have seen, first of all, let's say that this was a very strong joint statement. And it's very encouraging the fact that you plan to continue as a stakeholder network. This is very, very positive news for us. Thank you very much for that. It's also encouraging to know that you are going to do further work to do a white paper on the issue. And if I understood what Torsten was saying is that the issue is quite prominent. I mean, many issues which are in the joint statement already discussed with the member states and with the policy DG, which is, in this case is Connect, but also Sante is participating. I think in the next future there will be a lot of work in this respect between Sante, Connect, and RTD. So this will create a lot of opportunity, and indeed, I mean, to have a stakeholder network which is dedicated, let's say, to the topic might be very, very useful. It might create, let's say, opportunity for everybody. So I see this very positive. I thank you for all the suggestions. I mean, we will have to brainstorming with the team and see how we can solve that. Indeed, I mean, starting earlier, the thematic network is a good idea. This was for me also a learning year. This is the first year I'm dealing with the platform. So we got the platform in March. It was already too late, but only for you to know that for the next thematic networks, which will be the 19th, the kickoff meeting is next week, so we start a bit earlier. Unfortunately, the meeting will be also earlier, so it will be end of September, so there will be not a lot of gain in terms of time, but we will try to keep this for the future. And for the travel cost, I would like to add that we are also improving on that. I mean, we have requested more budget for 19. And hopefully, I mean, this is still under the approval of the Commission. This will be approved. So, I mean, this was also a good suggestion. And indeed, I mean, also the lesson learned from Horst is very important. I mean, how we can ensure sustainability for us is quite difficult because, honestly, I mean, we offer the continual assistance in the platform. So, the network can continue working, let's say, using the IT tool, which is designed for that, which is the platform. Of course, I think if the network find, let's say, also partnership inside the platform, and this is what I was trying to say at the beginning, that in the end, I think the platform has increasing a lot the number of users. We have increased in the last year almost 50%. So when we got the platform in March last year, we had almost 3,000 users in the different networks, and now we have 4,500 users. So this number is increasing like 100 per month, so 200 per month. Indeed, the networks, the joint statement, the meetings, they help on that. What I was trying to say at the beginning, which maybe the message was not passing enough across, is that in the future we would like also to enlarge, let's say, the user, in particular the dedicated network, also to the research community. So I'm referring to public health research, or RTD research, or Connect research. So they could use basically, this research group could do, we will offer to them to use the platform as basis. So basically to put everybody in one IT tool, which is the platform. And of course, I mean, this will also, when we will have enough research institute or university performing work, let's say, we would have also enough, let's say, possibility also to make this kind of initiative more sustainable, because of course, I mean, you can create the right synergy and you can create the right opportunity, let's say, to take forward work. So I don't know if somebody else would like to add something, also in the colleague here in Luxembourg, or somebody else for the group. I mean, also for the other joint statement, if they would like to add something on what has been discussed. There is anybody who wants to say something? No? Okay. So I thank you then, and we go to the second, right? To the second joint statement, which, according to my agenda, is the social impact of pain. Vittoria and Anka, they will introduce that. This is also a joint statement which is, let's say, very powerful, is very relevant, and is linked also, let's say, to a very important policy area. There are many millions of people, let's say, suffering for chronic pain. I am one of those. And I think this is something which would increase the opportunity for Europe, for the European Union, let's say, to increase the employability of people. And of course, it also works quite strictly towards the sustainability of health system. So, but I don't want to add much more on that. I think Ingrid is also, let's say, online, so she can comment after that. So, Vittoria or Anka, I don't know, wants to start. The floor is yours, please.
Thank you. This is Vittoria. Can you hear me?
Yes.
Yeah. Maybe I can get presenter right so I can share our presentation.
Yes, you can share your screen now.
Okay. So thank you very much. We are, well,
Victoria, can you make it full screen? We didn't do it before, but I think it's better. We can do it better.
The full screen on the presentation.
I had it full screen, but on the wrong screen.
Okay, now it's okay.
Okay. Okay, thank you. We have, well, you probably know who we are. We've been presenting ourselves quite a few times in the previous webinars and at the European Commission in November. But the Societal Impact of Pain is a platform of healthcare professionals, patients, and industry and citizen organization working on pain, and in particular for the joint statement is Pain Alliance Europe and European Pain Federation, which I represent, that has been leading the work this year. And indeed, I'm not going to go in much details in the focus of the joint statement, because there is extensive literature that we have shared both on the platform and on our own channels. But really, in a nutshell, this year we have worked with our own community, which is indeed the main partners of the Societal Impact of Pain, and 300 endorsers that also support us outside, but many others, which is indeed the big added value of this year's Thematic Network, the fact that we reached to others to really understand what were both the advocacy activities and the policy already relevant to tackle the societal impact of pain. And we have clustered them in 4 priorities, which are the one that you see now on screen. And on this cluster, we have developed policy recommendation, but also commitment that our community of multi-stakeholder community can fulfill to carry them out. And really very briefly, we need to better assess the impact of pain. As Giulio correctly said, there are 150 million, 1% in 5 that suffer of chronic pain in Europe, but we need better indicators to assess those and to ensure employability of people living with pain, better education for healthcare professionals, and more research to keep understanding how to unveil and how to tackle this problem. Really, the joint statement process has been a learning curve for us because, and I see that there are already a lot of similarity with what has been said by Karina, and really it has been an opportunity for us to produce evidence-based recommendation. And even if we have been existing as a platform for almost 10 years now, there were other initiatives, there were other activities we were not aware of, and really formed the bedrock of the recommendation via the framework paper, which we will continue use also as a stakeholder network to continue also our activities in the future. And the connection with the other networks was also really important. And I think that the lesson learned for cooperation there also mirrors one of the suggestions that I have in mind for carrying out the activities in the future. I think that as the health policy platform grows, it will be more and more important that there is a connection among the different parts, because this is another added value that can continue to attract stakeholders and really avoid duplication in a nutshell. It's easier said than done, but it's something that it would be really interesting, I think, also for many stakeholders that are out there and they are not yet on the platform, and they've not quite grasped yet what is the added value. The other thing is that we really managed to, because it's such a diverse community, the one that works on pain, we managed, for example, to understand what new activities, new projects of the Commission are relevant to some part of our community. For example, some of our stakeholders collect best practice, so we could connect them with the new activity of the Commission of the best practice portal. And you know that having that preferential channel was important for us because it gives even more like a push to our stakeholders to interact with the policy. And finally, the outcome is over there. I'm sorry if the graphics doesn't depict all the endorsers of the joint statement, which are 97, but we will update these graphics now. And really, most of them, they have also helped shape the policy recommendation and the commitment. And I think what we are really happy about is that it goes beyond our bedrock of patients and healthcare professionals. There are other multi-stakeholder platforms that joined, and also 12 policymakers that endorsed the outside the platform, the joint statement, which are 11 MEPs and the Ministry of Health, the Maltese one. I will now to give you the floor to my colleague Anka. I can again keep the slide presentation because it's just one slide as for Shafe about next steps that we will take after 2018 cycle.
Thank you, Vittoria. Hello, everyone, and thank you for the opportunity to meet again in this formula. Hopefully, not the last time. I will talk about the next steps that we intend to take in the work that we will continue to do under the SIP platform and connected to the stakeholder group. We would like to, of course, bring all this experience to the use of our national platforms, and it has been a good opportunity to mobilize our SIP platform endorsers into this higher level of contribution, and we would like to help them use this joint statement and level up their advocacy work on the national level, of course. We would also like to use this thematic network experience, and we have done steps already in this respect and to create new synergies. And we do have to thank the Commission for the recommendation that they did for us for our involvement in the CRODIS Plus project, which is ongoing and which also focuses on combating chronic diseases and contribute to the reduction of the chronic diseases burden by promoting the implementations of policies and practices that have been demonstrated to be successful. We do have a lot of common points, and we think we can make a real contribution to this project, and we look forward to. We will start in February with the first meeting. Of course, we will continue to build connection, and it has been discussed at the strategical level within the SIP partners meetings to have the communication platforms that we already had, the SIP website and the SIP platform in itself, with the SIP stakeholder group, which actually existed before the Thematic Network, and we would like to keep working with it and really integrate it in our communication strategy. We need, of course, to see how we will do that. There are still details to tackle, so not to duplicate the content. So we are currently discussing better ways to do that and to engage all the SIP endorsers to use the elements of the platform which we think are useful and bring more feature than we offered for a better communication and contribution to the common project. Of course, we will continue to use this group then to liaise all our partners, policymakers, new possible endorsers in this future work that we will do. So we do count on extending our reach, and thank you again for this opportunity, as indeed it has enhanced our reach and our community for the promoting of chronic pain management policies. Victoria, if you would like to go to the next slide. Actually, it's again a reminder that we are available for further inputs to our work, and also we would like to enhance the good collaboration that we had with the other thematic networks, the ones from the previous year, but also the current thematic networks, and we would like to offer our help to the 2019 thematic networks to share our experience and maybe some best practices we put in place during this whole year. Thank you very much.
So thank you very much, Victoria and Tank, and indeed thank you for your offer. We will take your message to Brussels next week, to the colleagues. I would suggest now, Ingrid, maybe if you if you have a comment, and then I try to wrap up a little bit what has been said. Thank you.
Okay, thank you, and thanks again to also Victoria and Anka. I didn't prepare a big presentation, but having followed a thematic network also the year before, first of all, I'm extremely impressed by the developments, let's say the more professionalism we see in these networks every year. I think in the first year, 2016, if a statement had maybe 20 or 25 endorsers, everybody was extremely happy. And last year, these statements had between 40, 50, And they were extremely happy because it was more than the year before. But if I now see that we are more than 100 or around 100, this really also shows me that the system works. And the beauty of it, as also Vittoria said, is that you're stepping out of your normal network. You can reach those you haven't reached before and you didn't know that they were there, but you actually have something in common with this. You're working on a joint goal, or at least on a joint topic. So I think this is really, really a plus. And you can see, I think, with all of the three statements this year, that they can take advantage of this health policy platform and the process to reach out and gain more friends and collaborators. What I also see in the statement on the societal impact of pain is that the possibility of NGOs to contribute to joint actions, even though now with the new regulation they don't have an option anymore to be an official partner, but they can, especially if they provide serious work like demonstrated through a joint statement, really make contributions and get their way into the joint actions. And we have seen this last year with a statement by ECDA, and that's the same also for this year, the statement from the SIP. So I think this is really, really a good development, and I'm very glad to see that. And I thank Anka and Vittoria for this energetic work. And I'm sure you will enjoy working with Matilda and the crew there in the work package 8. And maybe as a last point, to see also that let's say that the knowledge gained from the previous experiences, they really feed into the process and improving the process. And also the outreach of the physical meeting via the web streaming, I think this is also a plus, again, for the network members when they present their statements to a very wide audience and to people they may not have reached if it wasn't for the process. But we never should forget that they are also doing it on a voluntary basis. So, but if everybody agrees that there's something in for me, then obviously they will continue also with the work. And maybe as a last point, in terms of implementation, there are many bits and pieces, I think, in the statement that will find its way to implementing here and there, but we shouldn't be forgetting that we are also in a kind of planning phase in the Commission. So I think now it is a very good time, and again, I'm extremely impressed to have also MEPs endorsing this statement. So that may also be a way of getting one or the other action started, maybe not in this financial framework, but also via other channels in the future.
Thank you very much, Ingrid. Thank you for the nice word. And in general, I from my side, I can say that also this joint statement, I mean, was quite impressive. It's very, very comprehensive. And as Vittoria said, I mean, there is not only recommendation, because you cannot avoid completely the recommendation. It is legitimate to do that. But there is also commitment, so where I think we could continue working on that. I understood that you will continue with the stakeholder network as well. Like Ingrid said, in the joint statement there are many pieces which might be implemented in different way. And you asked to have much more, let's say, cross-border contact also with member states or the players. So my only comment here is we try to do our best, and we try, let's say, to increase very much the dissemination of what we do. And this includes also the dissemination of the joint statement. But don't under-evaluate the fact that Agora is a common part, which is seen by everybody. So there is an automatic system taking Agora twice a week, taking a picture of Agora. Agora is sending this to all the registered user. In the registered user, you don't have only, let's say, the NGOs community, like I said, but we have already many joint action working there. We have member states groups, working, let's say, in the platform which they receive the news every week. This is also important because to me, everything starts with information. I mean, already the fact to be aware that pain is an issue, or to be aware that there is something that we could do or not, let's say, is increasing political awareness, but also policy-making awareness about the subject. So we don't evaluate that, and this is basically also a kind of call for not only for the ZIP, but also for all the networks that be more active, let's say, in Agora, because I mean, Agora was supposed to be a kind of blog, so it's a common space where everybody can see, everybody can use. I don't have the impression that we are very much active on that. I mean, there are a lot of information flowing in Agora, but we are still far away, let's say, for the potentiality offered by this tool. So, and this is for me, let's say, my final word, unless there is somebody who would like to add something on that. Anybody wants the floor at this stage? Nobody? Okay, then...
One second, here's Gudula. Unfortunately, my video is not working. Sorry for this. And I want to explicitly thank Ingrid for her great contribution and collaboration there. Thanks a lot. It was really a big help for you to work with you and to get your ideas and suggestions, especially to be connected with Codis Plus.
Thank you very much. So,
just to say also, mea culpa, I owe you my contribution to the newsletter, but it's in the making, I promise.
Thank you. It's not too late, thank you.
Okay.
So I can say that English is really reliable, so I can I can confirm that. We pass now to the third joint statement, which is, let's say, fresh spell. And if I understood, we have Philippe Pina and Nicola Pisano online. So, who wants to start? I give the floor to you. You decide how you divide the presentation, or is only one doing the presentation, and then I'm not sure if Attila has connected in the meantime. I don't think so. Okay, then we will take the role of Attila in making an intervention after that. Thank you very much. The floor is yours. Nicola?
Yeah.
Yes.
We can share now?
We can hear, but
okay.
Yes.
Okay, well, good afternoon to everyone. You see our slide now?
Yes.
Yes.
Okay. Well, I will try to explain a little bit how we proceed and what has been the lesson that we have learned from our thematic network. I think it was a challenge for us because we have no point of reference in other food-related thematic networks. It was the first one, which was not specifically on health. It was a challenge for us last year to get the things organized, but we hope that we have delivered something, and we understand that you're all the time demanding because the thematic network has now to be changed into a stakeholder network, which means that we need to, you give us an incentive to continue. Basically, the way we have been progressing was to first make an evaluation, because we were the leader of the group, but we have involved a number of other stakeholders, and I think there has been quite an active participation outside the fruit and vegetable sector. And I think the first part was to validate some of our elements and build them with the consequences of the insufficient consumption. So that we were having a close link between, let's say, a business development in one particular sector and the element relating to health, non-communicable disease, etc. And on that basis, then we have tried to elaborate a number of recommendations in contrasting the different input that we were receiving, and we have identified 5 main blocks or areas relating to the economic area, the social area, the environment in which the business is done, the communication, or the need of cooperation. So that was, let's say, a second part, and then when we were finishing, we were doing also an infographic. I think our outreach was at the end 43 recommendations that we have tried to accompany with existing, not best practice, but good practice, because I think best practice corresponds also to a terminology with a number of implications. So we have tried to identify things which were already done, that we were considering were also delivering some local results, and out of that to give them a little bit more of visibility and also a source of inspiration. I must say in the process, we have been relatively positively surprised through the webinar, but also after of the followers, of the contributors. There have been at the end, beyond Freshfell, 6 organizations which have really contributed, help us to enrich the content of the different documents that we are producing. And then at the end we have, and this is a work in progress, we already have on top of that 28 additional stakeholders, but stakeholder could be also organization, which means that the multiplicator factor beyond those stakeholders are much more, and we still have 3 pending one. It's not that they are doubting on the content, it's more procedural things within their organization. And at the end, we see that the support and the building of this thematic network has been made on the one hand with the business, the fruit and vegetable sector, those who are in charge of communication in the sector, so the 5-a-day-like organization. We have a number of supply chain partners, which are the grower in Copa Cogeca or the retailers in Eurocommerce, even if in Freshfell we already have specifically for our sector a supply chain approach, but I think it's good to have a broader base with these 2 additional organizations. And then we had a lot of input from the health organization, the nutritionist, the practitioner, and I think this is a very reassuring element, because I think it validates also what we have always say, is that there is an important role of an healthy diet. So with most of these organizations, we had already a number of relationships, but I think the thematic network has helped to consolidate or intensify this and put on the table different perspectives, and I think the input of everyone has make our input a little bit stronger. Maybe a disappointing point so far, I think in all the process we had a lot of interest, I must say, from most of the member states. They were asking for the document, downloading the document. We have been talking about that with DG Santé, but also with DG Agri, but at this point, none of the public sector stakeholders, because I think in the public sector you are also stakeholder, none of them have formally endorsed. Maybe they are national policy, which is relevant, but it's maybe one of the maybe disappointing element of that. So it's really the stakeholder from the private sector so far who are on the contributors and ready to move forward. So I think on the lesson that we have learned, we could say that one of the challenge when we look at our practice, we have a lot of this which come with source at a regional or at a national level. So there is a limitation of the EU scope of any action. There are a number of reasons. Of course, the consumer are different. We have different kind of needs. For the consumer, you have very low consumer, the children, some of the millennials. You have higher consumers, so it's not necessarily the same. You have cultural influence into the consumption. You have also implication on the way of life. So I think all of that is maybe a challenge to find a recommendation which maybe at the end will be pan-European recommendation and valid in all the situation. I think the dissemination partner, I think that's a point that we see also as a positive element, because it's helped to reinforce maybe the action. As I said before, we have already a number of close relation with them, but I think this has helped to really have a broad-based discussion, and I think through their network they are also able to disseminate further the message. I think we have seen also, and when you look at the number of recommendations, I think it's quite positive. There is a large unanimity behind the recommendation and the concerns. So I think there is a common understanding that there is a significant problem, and everyone was keen to cooperate and to endorse with a relatively open mind the recommendation. Maybe one of the points, and we have discussed that with you and with also your other colleague in DG Santé, that it should not be a policy recommendation, but at the end, when we look at a problem, there is not one magic solution. In all the difficulty and lack of consumption, and it's linked to a number of implications with responsibility for a very wide range of stakeholders, which include the private sector, and I think we definitively take our part of responsibility, but it has also a number of responsibility from policy. So I think we thought that all our recommendations, which were policy-minded, had to remain into the final document. This is because this is part of, I think, the full picture that we want to provide in this effort, because we understand that if we want to change the situation, we really need a lot of support from different perspectives. And I must say we have enjoyed the two webinars. I think they were relatively well attended. There were a lot of additional view after the physical presentation on the days. There were one in July, one in September. So I think all of that has been quite positive. And now I think what we have to do, we have dedicated time and effort to reach what we have reached so far. So we understand that there is a benefit to build on where we have been so far. It comes therefore as a logical follow-up that this stakeholder network that we have built and continue to build will need to be continued. We will definitively, and I think most of the signatories continue to use the document as a reference document. I think it has helped to articulate the different ideas and the different tools that we could consider to improve the situation. So I think we have to see how we can really build on them, and on that basis continue the appropriate initiative that we could do. We will continue not later than next week. There is a major fair for the fruit and vegetable sector in Berlin. There are more than 80,000 participants, but that's a good opportunity to continue valuing to those of the sector what we are doing. Of course, as an association, we don't reach out every day to these 80,000 individuals in the sector, but we have strong cooperation across Europe with different national organizations. But so we'll continue inside the fruit and vegetable sector to consider and elaborate concrete action and foster our collaboration. We have, and maybe you know it, been involved, or we will be involved in the next 3 years on one of the promotion projects of the Agri, focusing on health and the millennials, which are probably the category which have received the less attention so far in the communication on the benefit of eating fruit and vegetables, but they are at the same time the consumer which start to be taking the control of their diet and of their expenditure. So we'll try to be successful in our campaign that we will do with a French partner, which is known in DG Santé. It's Aprifel, which is also the organizer of EGEA conference, where Mr. Calamarche was also there. And I think, Ingrid, if you're still there, you have been in previous EGEA conference. So we'll continue to seek more endorsement, which will mean more partnership. And I think the visibility of this has been also already a request which has been made to Nicolas to go to Norway next month to discuss with our Norwegian member. Also, they are out of the EU, but I think we could learn from them as well about partnership for a healthier diet in Norway, so that we could get inspired also about things that are done elsewhere. But I think that's also an indicator that the effort of the Thematic Network was watched by people and which wanted to get also some inspiration from us. And yeah, indeed, I forgot that our French member has said that the document was very interesting, and the document, which was initially in English, has already been translated in French. So that's also another step for the dissemination, which has been welcomed by us as well, rewarding a little bit the engagement that we had into the project. So, Giulio, I think that's in short the message that we wanted to pass about the lesson that we have learned and what we plan to do.
Thank you very much. Indeed, it is also a very important joint statement. I mean, I apologize that the colleague of C4, Attila, is not with us today.
We were in Luxembourg 10 days ago, and we met with Stefan, with Attila and Abigail.
Yes.
Were there, and so we had already some exchange about how they see maybe the weaknesses, or where they had some additional comments that we try, and we have tried all the process to take into account.
Yes, indeed. I think at least I know, because I talked to them, that they were quite happy with this joint statement. They were following with interest this joint statement. And indeed, I mean, you are dealing with a topic which is also, let's say, very much important for us, very policy relevant, very important, because only for the fact that it's linked with chronic disease, it's linked with obesity, with children. So it's a topic which for sure, I mean, there will be no problem for you to find the right synergy. So that's why I think it's very encouraging for me also your intention to keep, let's say, the content network in the platform, and to produce, let's say, much more work. Having this joint statement as a starting point. So this is something that I would advise to everybody. I don't know if maybe Ingrid in this subject would like to add something, because it might be relevant for the area she's working. Ingrid?
Yes, I'm still here, and yeah, Attila has been sending emails, so he's somewhere. So I don't know why he's not connected. But just to say, I mean, we are obviously very supportive of the promotion of fresh fruits and vegetables consumption. Also from our point of view, as we work on the prevention of non-communicable diseases. So it's really great to have the statement. It's great to hear that others have already taken it on, that you have a French version, because that is obviously something also to consider. I mean, as long as you work on EU level and at platform umbrella organization level, English is fine. But the minute you want to reach out to national organizations, and I actually had a lengthy debate with the Spanish diabetes organization the other day, saying that why can they not contribute in Spanish to the health policy platform? So I mean, I just leave that here because I couldn't really answer their question. But if there's anything we can do to help, there is the best practice platform. If you are planning to really seriously look at best practices, we could definitely discuss if you wanted to do this via the platform. We could do this. We are in touch actually with DG Agri to look also as a service provider to them to collect best practices, probably linked to the fruit and vegetable scheme for them. So again, also thank you for your good work, and I'm also glad to hear that you could reach out to maybe those organizations you're not in touch with on a daily basis anyway. And we could link a bit further maybe the fruit and vegetable sector also to the health sector, because I've seen that I think the HEART Network and also the Public Health Alliance, they have been actively contributing, which I think is also great that the cross-sectoral working together.
Okay, thank you very much, Ingrid. I think we are 20 minutes over our time, but maybe if you have still a couple of minutes, I would like to ask the participants if they have any additional advice, let's say, in general. This advice might be, let's say, the organization of webinar, timing, promotion, let's say, the visibility of the networks in the platform, if you have suggestion for that. Also the platform meeting, if you have better suggestion for us. It's just, I mean, what is coming into your mind that this can be improved, so that we can put this in minutes, and let's say we can have also an internal brainstorming how to improve things. I don't know if somebody would like to add something around this topic, something very quickly. Somebody would intervene to that? No?
No.
Oh, okay, then I think this already was... Who? Okay.
That's Victoria. Hi.
Victoria, please.
Yes. I just wanted to say, if you aim to make the platform something that you want to also to open to research consortia, or anyway, have these different kind of activities, one thing that surely has to be looked at is the potential for interactivity. So if this becomes a place with working groups inside it, they should be able to, I don't know, receive like a share version of their documents, being a little bit more triggered to interact, because it's, as you pointed out before, it's a place for information right now mostly, and a little bit I guess also technically needs to be done to push the stakeholders, and most of them are not super tech savvy to more easily see this as a working place.
Yes, indeed. This is very good. My dream was always that we could have a kind of, let's say, blog in Agora, so that also, let's say, feel free to express opinion, and of course, everybody has constraints, which is organizational constraints. It's also for me the same. Sometimes I would like to post something, but then I have to ask for approval. It takes time. Then when I get the approval, the news is already too old. So, but that's why we try to post very much to be more active on the information side. So we have, let's say, a good communication with our Sante website. And we try always to inform, let's say, the user of the platform about the last news in the website. But if the, let's say, the NGO community might be a bit more active in posting, also asking for polls, for opinion, this would also help, of course. The opening to the research groups was to institute or university. They can use this as a network. But of course, if somebody is opening a network, Tukur is also a user in Agora, so Tukur is part of our community. So I think for the future, this is a mutual interest to work a little bit on this issue and try to improve this tool. We have some IT limitation, which unfortunately, we have to follow rules here. We cannot go outside these rules. We try all the time to improve also the IT tools, but I think it's also ourselves not to be, let's say, not to use the tool in a very active way. This is something we could do daily. And in the future, I intend to work on it. So, if nobody has any other commitment, I would like to close now the meeting. Karina, okay, Karina, please. Karina?
Hello, can you hear me?
Yes.
Yes, okay, sorry. I was saying you were asking for suggestions on the platform, and I would like to leave one, especially because we are really aiming on having the stakeholders network hold also here and the Portuguese network as well. And it would be good if, when we have a link, for example, to the network, this is visible even if for people that are not registered yet, and they can see the image and a summary. And then if they want to see something else, they have to register. But we don't have anything to showcase if you are not registered, and that's not very appealing because they lose track of what they are registering for. So this would be very important, I think, to attract stakeholders. And at this point that we want to send them somewhere, it always blocks there. So I leave you with this suggestion. I know the constraints, of course, but I would like to leave it with that. And just on a final point, because I send it by private message, but I think I should send it up loud, was to say that of course, this has our thematic network had a very strong link with DG Santé, but I also need to make a very big thanks to Horst specifically, because our connection of Shafe with DG Connect is of course very strong, as you know, but very specifically Horst's support and engagement in the network was really important. And you will be leaving sometime soon with a big regret from all of us. And it wouldn't be fair not to say this now, okay?
Okay, thank you very much. Indeed,
thanks, Karina, for making me blush for the end of this project.
You're welcome.
I said that it's a good suggestion and we will try to follow up it. I mean, this will depend very much on the rules we have in house. I was also exploring this possibility, but this is not fully clarified. But I see the point, I think, to have a view, just the view, let's say, for everybody, public, and then for posting only the user. Yes, it's a good idea. Thank you very much. So before to close the meeting, I would like to ask the participants. We say that this meeting is recorded, but we didn't say that it will be posted. It's up to us to decide. So because we are in democracy, I would be in favor of posting it, but let me know if somebody is against.
No problem.
So everybody agree?
No, fine with that.
Fine. Then we will post this in the platform as well for the later viewer. Finally, before to close, I would like to make a couple of statements, meaning that, like I said, next week we will open, let's say, we'll have a kick-off meeting with the new thematic networks. Indeed, I mean, have a look also to these thematic networks, because some of you might collaborate with them and could also help them, let's say, with your experience. So, for this year, we will have the meeting of the platform, which will be also the new award, the joint statement will be at the end of September. Will be not in November, but will be in September. This is because in November there will be a big change in the Commission, so we prefer to avoid the month of November for that. Well, the call for let's say for the work plan to 2019 is at the moment in inter-service consultation. This means that this will be published, let's say, in a month's time, more or less. And in this document, I mean, I cannot disclose now the award for next year because it's still under competition, so it's in the work plan which is not published. So you will know what is the new topic for the award. And then you will also see the possibility, let's say, to apply for project or the issue under the public health program of DG Sante. I don't know if I forgot something.
Well, there is one point regarding the webinars that you have already done. So last year, 2018, we have a new policy and they will be deleted after the 6 months of creation. This is something that will also apply in 2019. So from 1st of March, those webinars that have been recorded in the last 6 months
will be deleted, which means that we will share with you the link to download your webinars before that time, so that you have time to inform also your community and then download them if necessary.
So then that's all. Thank you very much for participating. Thank you very much for the work you have done during this year. It was really a pleasure for us, let's say, to support you. And indeed, I mean, we are here. I mean, just drop an email. And I would like to thank you again, and to thank also the team of the platform here, because they did a wonderful job also in the organization of the meeting. So we have enough to do, a lot to do. And I think you are in good hands. So basically, come back to us for everything you would need, and thank you again.
Thank you. Bye-bye.
Thank you very much.
Thank you. Bye-bye.
Thank you.
Bye.